Joining us now from the Becker's CEO CFO Roundtable in Chicago is Dr. Todd Schaffer, President and CEO of Sanford Health Bismarck. You've said Sanford Health is reimagining how care is delivered, even amid workforce and economic pressures. How are you building a culture of trust, innovation, and operational discipline to make that vision a reality?
So what we're really trying to do at Sanford Health is to really build that culture of trust through everything we do on a day-to-day basis. So when we look at the operational effectiveness and efficiency that we really want to focus on employee satisfaction. So if we have providers and nurses that are satisfied with their job, they're going to do a much better job of taking care of our patients in a friendly, safe manner. And with that, we also really strive to provide the highest quality of care in the safest environment. When we look at it as an organization, we have reduced our serious safety event over 70% since we've initiated our safe perspective. In addition to that, we have our financial stewardship to help balance all that as well. So if we're not able to invest in technologies and our people and in the ability to take care of our patients in the safest way possible with infrastructure, and access, we're not going to be able to build that culture of trust amongst our patients. And if patients don't trust us, they're not going to seek care with us. As we've seen record volumes across our entire footprint, we know that patients are starting to trust us and continue to trust us more and more for their healthcare needs. Patients really choose and vote with their feet, and we're seeing that all across our footprint.
Sanford has long been a leader in rural health transformation. How are you prioritizing investments that strengthen access, quality, and sustainability, not just for today's needs, but for the long term, specifically in your region of Bismarck?
I think one of the most important initiatives that we've had to really give access across our footprint, given the fact that we're so rural all across our organization, as well as we have decreased access amongst all of our competitors across our footprint, is to leverage our virtual care initiative. Through a generous gift from Mr. Sanford, we've been able to invest in our virtual care facility, which has now grown to about 78 different specialties that we're able to offer these services across our footprint. When you look at the statistics, we've been able to save patients on average about 176 miles per trip, well over 50 million miles saved since the virtual care initiative has started, which can be quite significant, not just for access and be able to be close to home, but for those of us who have driven across any of our footprints in the middle of winter. Some of these road trips can be dangerous, and patients may not be able to travel in those conditions to reach their appointments. So, as an example, we have a pediatric pulmonologist down in Sioux Falls who outreaches to Dickinson, which is about 550 miles away from that clinic. Based on the virtual outreach to Dickinson, that saves patients 1,100 miles total. So really, how do we then continue to leverage additional services in that virtual care arena to provide care close to home, high quality, and give access to a variety of different specialties so patients can do it from the comfort of their living room?
Yeah, 2 hours might be a short drive in Western North Dakota, that's
Right.
for sure. As you look
Yeah.
ahead, what gives you the most optimism about the future of rural healthcare and Sanford's role in shaping it?
So what makes me the most optimistic is, given all the challenges we have right now, this gives us an opportunity to really transform care. How do we think creatively? How do we think outside the box and continue to leverage our um, our position in thought leadership to help drive the narrative of how we can do things better? So it's easy to complain about a lot of the uh, challenges that we have, but how do we step forward and say, here's challenges, but given that, here's our solutions. And how do we continue to lead the way in this space to help drive policy, and which ultimately will drive access throughout that. So super excited about these opportunities that we have. And now we get to really think creatively to be able to provide the services to our patient and provide world-class care across their entire footprint.
Thank you so much for your time today, Dr. Schaffer. That's Dr. Todd Schaffer, Sanford Health Bismarck's president and CEO. We appreciate your time. We appreciate your expertise. Enjoy the rest of your time in Chicago.
Thank you so much. Have a great day.
You too.